I'm Blake Farmer, and this is Nashville. Our guest this hour is Tennessee's top-ranking social worker. Marie Williams came up through homeless services in Memphis, found her way to the state agency that oversees mental health and substance abuse services. In 2016, Governor Bill Haslam appointed her to lead the agency she's now been a part of for 25 years. She's here to talk about her life, her work, and her philosophy that has guided her career trying to fight off the stigma of the heartless bureaucrat. Welcome to This is Nashville.
Thank you. I'm so glad to be here, Blake.
Well, I was watching you at an event this year tell some powerful stories about how you got into the work of dealing with addiction and homelessness. And you were talking about your own journey, which we'll discuss this hour, and you got choked up. But it wasn't where I thought. Your voice kind of started shaking when you were talking about your team at the Department of Mental Health. What is it about that team, praising that team, that gets to you?
I'm so glad you asked that question. I literally was talking about that driving over here with our Deputy Commissioner, Matt Yancey. And he was saying, we have a team that feels safe to be who they are. We have a culture and a value system that we support and that we try to live out that really focuses on individuals being respected because of who they are and really focusing on strengths. But that particular day that I got choked up, it was because when I was being asked about my history, I'm so aware that where we are today in this state is in large part due to the people that surround me. I've often said I hire a lot smarter people than me, a lot better people than me. They all have different personality types, which I like, and they just make our department and the people that we work on behalf of, as well as our provider community, the best it can be. And I'm just honored to work with such a wonderful group of people.
Since we'll refer to it so often this hour, and people may not really know what it does, can you explain what the Department of Mental Health and Substance Abuse Services does primarily?
Yeah. When you look at the legislation about what we do, just to break it down, make it easy, we plan for, promote, and provide a wide array of services for Tennesseans in this state that are struggling with mental illness and substance use issues. In particular, we focus on those Tennesseans that are uninsured, poor, and underinsured. And each year that I go before and present my budget to the legislature, one of the things I focus on is here's this pie chart, and it shows you the number of Tennesseans here that are struggling. It shows you those that are covered by Medicaid, Medicare, VA. It shows you those that are covered by private insurance. And then it shows you this niche of uninsured Tennesseans, the poorest of the poor who don't have any support. And each year I get really excited to say, because you funded this, we've been able to serve 50% of that population. And it's not just the serving them that matters, it's the outcome of service. So when you have someone that's below the poverty line that all of a sudden gets treatment and they're no longer feeling like they can't work, they actually have hope. I can work again. Not only does their life get better, but the economy gets better.
Yeah.
They come off of that program, they're succeeding, they're mirroring for others how to succeed. It's just a win-win-win. In the state, we have over 38,000 Tennesseans that get those services for uninsured mental health services. So,
is there? I imagine it's probably frustrating to keep track of the numbers and know. Well, I know how many people we've helped, but you also know that there are other people who start needing help right behind them. What's the I don't know, figure that you've been proudest of, that like this has changed and we feel like that's because of the work we do?
Absolutely. I can give you multiple figures. If you look this year at the decrease in overdoses, it's gone down 30%. since the peak, which was right around 2022.
Yeah.
30% less people dying.
And are those 2024 figures?
2024, yes, I believe they're 2024. Yeah, the latest that we have, right? So you're like, wow, you can see that impact. If you look at children and youth who were really struggling during COVID, we're seeing a reduction, almost 25% reduction right now in anxiety and depression. What is that because of? We really believe the school-based behavioral health liaison program, that we are trying to get one in every school in this state, just like we've done in the state with the SRO program, school resource officers. I'm a big believer that we need as much help with our hearts and our heads as we need with protection. So let's try to do both. So we're really hooking up our liaisons with the school resource officers so that they can see the same things that the liaisons are seeing, and that we connect not only that child to help, but we have countless stories, outcome stories of that child and then their parents who are struggling with addiction or mental illness, and they also get connected to help. So you're healing not just a kid, you're healing that whole family unit.
If you're just joining us, I'm Blake Farmer. This is Nashville. Our guest is Commissioner Marie Williams, who heads the Tennessee Department of Mental Health and Substance Abuse Services. You bring up the overdose deaths, and not that all of those are opioid related, but man, the opioid crisis has been front and center for you in your time as commissioner. Are you feeling like the worst is well behind us now?
Yes,
yeah.
Related to opioids.
So is the issue that's like, well, there's always something behind that. What's the next thing?
We're seeing increases with new laced drugs, and those then are not prescription. We're seeing laced drugs that are counterfeit that are coming in to our state and our country.
Yeah. But not opioids? It's still an opioid.
There's still opioids,
realm, right?
But those are reducing.
Well, at least looking at the latest numbers I saw, Tennessee's drop off in overdose deaths was not quite as dramatic as nationally the number has moved. Does anything explain that to you?
That's a great question. I've been asked that. There's a lot of research around what is causing the state of Tennessee to have higher death rates than national. If you look at some books that have been written, you'll note that they talk about that Appalachian area that were really heavily targeted by pharmacy companies, pharmaceutical
You're saying
companies.
going all the way back to Purdue Pharma when they were pushing opioids as doctors were prescribing them more in these states, including especially East and Middle Tennessee.
Exactly.
Yeah.
And so when you look at those high numbers that are already getting that medication, and then you look at people around that person that might have borrowed medication, and then you get hooked. I mean, it's a vicious cycle, but I still look at we're reducing deaths, right? So we're going in the right direction.
Do you think going through what state lawmakers have gone through over the last decade or so in dealing with the opioid crisis, do you think state lawmakers now see addiction as an illness, which I think they're told so often, but probably sometimes have a hard time believing?
Yeah, no, I can't say enough positive about our lawmakers. When you look at our state's budget for mental health and addiction, we've grown by over 70%, a large since Governor Lee started in his term. That is due in part to him and his leadership, which we're grateful for, but also our lawmakers like Speaker Sexton, who has said, I want to have a mental health recovery court in every county. He laid that out, and he put the money there to do that.
Yeah.
Total support. The governor and the speaker and the leader and the lieutenant governor wanting to add dollars so that we could serve more individuals through recovery residential courts. And that's really very intensive treatment, residential, for individuals that have been in the criminal justice system that are then in treatment for substance addiction and opioid addiction
So this is instead of perhaps going to jail, then coming back out, getting back into the same thing, that you instead take this other path that a court has prescribed.
Yeah.
What has that evolution been like? I mean, I was, covering the state legislature 15 years ago. I think conversations were very different. A lot of hesitations about how we were going to attack addiction and the opioid crisis. Like what could you point to that sort of shows maybe some evolution in how people think about it?
Yeah, part of it was Governor Haslam at the time put together a task force called the Prescription for Success. And as part of that task force, he included lawmakers, he included other commissioners. It was a really joint effort that Governor Lee continued. And I think by pulling people in, as well as the fact that many of our legislative leaders have their own home stories of people that are struggling. They call our department regularly. Hey, can you help Joe?
You're saying almost like constituent services, like, hey, I've got a family.
I'm serious about that. And I so love when they call us. I'm like, thank you so much for calling.
Yeah. It's become more personal for them because they know enough people.
I believe it has. I can't speak for our legislature, but I believe from my experience and talking with them, they all have a story, and they also have a story of how treatment has helped. So when you know that there's something that helps, let's fund this because we see the return on the investment by doing so.
Is there anything that is still sort of standing in the way of treatment that you all would like to provide and expand, that you're needing state lawmakers to move on? I ask because I know we had on the show a few weeks or months ago folks talking about medication-assisted treatment, so like Suboxone, that would be mobile, that could be done in a mobile setting. Are there things that you need state law to change for you all to keep, the trend moving in the right direction?
Not necessarily laws to change, because one of the other great things that Governor Lee funded, we are still doing, are rural mobile health, behavioral health clinics, where he focused on distressed counties when he first came into office. And we were able to get grant awards to actually buy mobile clinics with our community behavioral health partners. And that also has been amazing. But no, I don't think there are barriers related to legislation. Mainly the barrier, and they know this and they ask about it, is the dollars for the uninsured. We have a gap, and you don't treat people without people. You have to have people to help the people, and you really need trained people to do that.
Well, so what do you mean? You're saying dollars to pay the providers? In other words,
yes.
if they're not going to come in with some sort of insurance coverage, whether that's Medicaid or otherwise, TennCare,
right, that
there needs to be some way that we pay people.
Absolutely. And they've done so much, but there's still a gap. They know that. We talk about that.
I mean, we're expecting many more people to be uninsured starting next year, whether that's because it's too costly to go on the marketplace or other ways that people are losing coverage. Do you expect that problem to get better?
Well, I don't know if what's really going to happen. There's still a lot going on in Congress about what's going to get passed, not passed. So I think there remains to be new news with that. And so I don't know if we're in a place to say definitively.
Would you be comfortable talking about your own experience with addiction as when you were growing up?
Mm-hmm. Absolutely.
Yeah, I've read just a tad bit, but how did this affect your family growing up in Crockett County?
Yeah, thank you so much for asking about that. It wasn't Crockett County because my mother, no, I grew up in Crockett County, but we didn't move there until I was 10 years old. Okay? Yeah. So I was born in Fayette County, Summerville, wonderful little town.
Outside Memphis, right?
Outside Memphis, yeah. And my dad worked really hard. He was working at the fire department in Memphis. He cut firewood to sell to people in Memphis, and then he worked at my grandfather's gas station, so he was gone a lot. And unfortunately, my mother really struggled with alcoholism. And so how that impacted me are multiple ways. I'm the oldest of 5. So it impacted me in that I really took on that responsibility to take care of my brother and sisters. So one of my memories is coming home from school, and Mom was not present. She was asleep on the couch, and it was lunchtime, and they hadn't eaten. And so I was like trying to make soup and trying to put together sandwiches. And I felt so much anxiety about getting home at lunch because I wanted to make sure that they had been fed.
You were coming home from school?
Yeah. I would
lunch.
walk. Yeah. I'd walk home from school to make them lunch and then go back to school. And one of the things about the liaison program, why it matters so much to me, is when I look back, at myself, as many of us do, when you're an adult and you look back and you go, wow, there were so many signs with me that if there had been a liaison that said, that kid's not wearing clean clothing, that kid's not here at lunchtime, they're walking home. Like, I don't even know if a teacher even noticed. What's going on? Things might have changed quicker. My mother did quit drinking. Things got better. But for my early years, under the age of 8 and 9, those kinds of experiences really impacted me.
Yeah. And what has that changed about your approach in working with people who are kind of trapped in addiction?
I would say a compassion, because I know that if my mom could have just shifted and said, hey, I love my kids, I don't want to live like this, she would have. So that compassion for people, that understanding that if kids do get support and if parents get support, their lives can be completely turned around. I mean, I'm seeing it. Like I said, we can give you success story after success story. So I'd say the basis would be just that compassion. And then probably, I talk a lot about calling, and that felt very called at an early age to help individuals struggling with addiction and mental illness. I just felt called in that regard.
Well, we'll talk about that coming up, but we need to take a break. So when we come back, we'll get more into the personal story of Marie Williams, Tennessee's commissioner overseeing mental health and substance abuse services. And we'll start with a bit of that life-changing story. Stay with us. This is Nashville.
Funding for This is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Blake Farmer, and this is Nashville. Marie Williams was probably always headed towards social work, but there's social work in an office and social work on the streets. As commissioner of Tennessee's Department of Mental Health and Substance Abuse Services, she spends more time in the office these days, and she started her career with a pretty cozy office, but had an inexplicable draw to working in the streets. Commissioner Williams, there was this Wednesday night church supper where you answered a call. How did you decide to kind of give up the somewhat cushy job for a recent college grad and get into the messiness of the work in addiction and homelessness?
Yeah, and I don't even know if it was a decision. Like I said, it was just like this immediate call. So there was a man that came to our church. My daughter, Nicole, was in Mother's Day out, and we had gone to Wednesday night service. Her dad was working and couldn't come. So anyway, she's in the nursery, and I'm at this dinner, and this guy's speaking. His name's Kim Moss, and he was the executive director of the homeless program at Midtown Mental Health Center in Memphis, Tennessee. And he's talking about working with homeless individuals with mental illness, and I'm just like sitting there glued, like, hey, when he gets done, I'm going to tell him I'll volunteer for Mother's Day out. I'll come volunteer at his place. And so Kim looks up at me when I go to talk to him. And I said, look, I just had a baby and I just would love to help.
You're saying you have all this extra time on your hands because she's at Mother's Day out
she's
for
at
2
Mother's
hours.
Day out. Yeah. And yeah, exactly. And I had, that 3-month leave. So anyway, he looks at me and he goes, what's your degree in? And I said, well, I've got an undergraduate in psychology and I'm working on my master's in social work. And he said, do you want a job? I just was like, I got a job. But I just said, yeah, what kind? He said, well, we're hiring for homeless case managers. Come see me, bop, bop, bop. So I go home with Nikki, put her to bed. Her dad's there. He was an accountant at Coopers & Lybrand at that time. And I remember he was sitting on the floor. He was doing his, checkbook manually. And I said, you're not going to believe this. I talked to this guy that runs the homeless program for mentally ill people, and Mike just stops, writing and looks up at me. And I said, and they've got this job for this case manager that I'm going to apply for. And he said, what? Like, have you lost your mind? Are your hormones okay?
Oh, you just had a baby.
Just had a baby, yeah. And I said, I'm fine. And I could tell he wasn't really going to be fine. And I said, I probably won't get it when I go in. And he said, oh, no, you're going to get the job. So that's what started. It really was that calling married with a man who on the spot said, do you have this degree? Do you want a job? And I'm so grateful. I still stay in touch with Kim. He lives in Memphis. He's retired. He knows how much that entrance into this field of work has changed my life.
Yeah. Well, what was that work like, case management? Mm-hmm. I mean, was this helping people get into housing somehow?
It was everything. Case management was everything. So you're meeting with an individual. What we did is we started at Calvary Episcopal Church in Memphis, Tennessee, in the basement. I was supposed to get trained to do assessments. I was going to get trained. The first day on the job, Kim's like, there's too much going on. Look, here's the paperwork. Just go down there and do it. And I'm fine with that. I'm the oldest of 5. I've come from an alcoholic family. I'll take whatever paperwork, you want me to do. And so I started. So what I would do is I would assess individuals and then do it wasn't a diagnosis, but what was my impression of the diagnosis so that it would then go to the psychiatrist. Once we got them in our program, we would then, as case managers, work to get them to where they were self-sustaining, self-functioning in recovery. So that included finding housing for individuals. It included finding their way to pay for pharmaceuticals. It included making sure they were in intensive treatment, therapeutic treatment. And then it included how are they going to keep a house, employment, Social Security, whatever you could do to help that person be self-sustaining. That was our goal.
I imagine you worked with mothers and children.
Oh, absolutely.
What was that like after you have your own and you're sort of trying to imagine what it takes to live life on the streets, whatever that looks like, when you're also trying to care for your children? How did that affect you working with other mothers trying to care for their children while not having a place to lay their head?
Oh, yeah. One of my first clients that I had, she was a mom, had 3 kids. She had bipolar with psychotic features, and she had lost to the state all 3 kids. They were in state custody, and it really changed what I felt like my next part of my calling would be. So Nikki was probably 4 or 5 months old. And so I have Nikki's, car seat in the back. And she calls me to say, this woman calls me to say, I have found the place. Let's go look at it.
Oh, she's somebody you're doing case management for, looking for a place that she could maybe use her benefits to pay for?
Right, and bring her children. So she was now stable. We had helped her get on medication. She's stable. She's in therapy. She's about to get a job.
Things are going well.
Things are going really, really well. And so I pick her up at the shelter and said, okay, where are we going? She goes, well, we go this way, that way, this way. And as we're getting closer to where she's beaming, she is excited. I'm driving as a 25-year-old mom, like, no. Like, no, I couldn't bring my daughter here. I would feel so, like 8 blocks back, I would have stopped. And we go and continue many, many more blocks to a place that was as depressing as I've ever seen. It was a 4 quad, concrete. It was raining that day, which was even more depressing, and she's still beaming. So as a social worker, you're supposed to meet people where they're at, and I'm just having this internal struggle of, oh my gosh, she's going to bring her kids here. I wouldn't bring Nikki here, and she's beaming. I got to stay with her. And we walk in, and in this room, and it was one room with a toilet that was in the floor on one side, a bed mattress that was totally soiled, all kinds of stuff on the floor, a kitchen, not a kitchen, but like a stove range that wasn't working, and then water coming down from the ceiling. And I'm literally about to just start sobbing, and she's beaming. This is what I can afford.
But at least it's a place that she would be.
This is where I can bring them and bring my kids home. Wow. So that's when I really added, okay, we got to do safe, quality, affordable, permanent housing. This is not okay. And so that really added. If this is the
best that they can do, then it's not enough. And we need a new plan.
Yeah.
If you're just joining us, I'm Blake Farmer. This is Nashville. Our guest is Commissioner Marie Williams, who heads the Tennessee Department of Mental Health and Substance Abuse Services. So how do social workers deal with that all the time? Is this why there's so much burnout?
That's a great question. I was with the dean of the College of Social Work for UT last night. They were having a Nashville event for social workers. I've worked in this field for 35 years, and one of the things that I've attempted to model for myself and my team is that, you're of no use if you're not good. And there's always going to be need. We're not going to serve everybody. So if you can adopt this mindset of, I'm going to do my very best today, every day, see as many people as I can, do the most quality work I can, but to realize that when I step out, God's still there. So helping individuals understand it's not just you that's the answer. And if you can focus on what you've done and not what is to do, that really helps you with your own self and burnout and all of that. Having support, being open enough to say to someone, I'm feeling really burned out. I really encourage people, let me know, how are you doing? What's going on? So that I can help them. Like if you need to take 2 or 3 days, take it. Because I know that you'll use that time to really re-energize yourself, get the help you need to come back in and start again.
So what drew you from kind of the case manager work to working more in government where you're sort of working with organizations that would do the case management?
Yeah, I never imagined that that's what I would do. When I was working at Midtown Mental Health Center, I got hired by Catholic Charities because I was doing my internship there, working on my licensure for social work. And the guy there, director, said, can we hire you? And so I started at Catholic Charities, and we went from 1 residential site to 3, serving 99 individuals from 14. And then while I was there, a young woman who's still a very good friend of mine who worked at the United Way, who's now a professor in anthropology at University of Memphis, she had something come through United Way that said HUD was looking for community builders. So
it's like the Federal Housing and Urban Development?
Yeah, Federal Housing and Urban Development. They're going to do this big new program called Community Builder Fellowships. And she comes up to me at the office, this is you. You have to apply for this. And I'm like, I'm happy. I'm feeling good. she continued. She's like, this is you. Like, you could make this difference on a statewide level. So the night of the application closing, she and her husband came to my home after I'd put Nikki to bed. They helped me develop a resume because I didn't even have a resume. You had to have one to apply. Yeah. And I applied, and the rest is history. I really was shocked I got the role. There were only 2 for each state when it first began, so I felt really humbled by that. But once I got that role, I met Commissioner Elizabeth Rukeyser, who was the Department of Mental Health Commissioner back in the year 1998, which is when I met her. And she then hired me when they ended the Community Builder Fellowship, and I just have felt such gratitude to be able to serve in that way. But that's sort of how that happened.
Your resume now is kind of hilarious because it's so long.
It is. Yeah, to go from I don't have a resume back in
to now Matthew Perry over here is sending it, and it's like, do you want the short or the long one? Well, the long one, it kind of like bowls you over. But there's a list of 20 programs that have started under your leadership, and I know that you're involved in varying degrees, but that were huge. The peer recovery folks, the Creating Homes initiative. Yeah. Like when you're thinking about your work that you then were able to do on a statewide level, is there one that's like that's the one that had more impact than any of them?
Yeah. I'd have to say right now, I mean, there's so many, but the Creating Homes initiative. The reason I love that program is, when I got hired by Elizabeth Rukeyser, that's the plan program I wrote out for her. And it was all based on leveraging funds.
Oh. So this was your pitch when you kind of were originally coming into state government?
Yeah, this is what I can do. And she was an incredible person. She took a look at the pitch, and I'd worked on it, and stayed up most of the night nervous about talking with her. It was a 2-pager. Thought she'd have questions. She didn't have any. She looked at it, she put it down, and she said, I support this, move forward. So I'm just like, I've got answers to questions that I was hoping you'd ask anyway. So the Creating Homes initiative started out with $1.5 million from the state legislature, and we have leveraged since the year 2000 over 1.2 or $3 billion dollars, created over 36,000 housing options. That's 36,000 places, like beds, that turn over once a person doesn't need that anymore. So we're talking hundreds of thousands of Tennesseans that have gotten safe, affordable, quality permanent housing, places where we would live. Places that young woman I worked with would have just not even believed she could have had. So I would say the Creating Homes initiative is one of those flagship programs. It has expanded under a Democrat, under a Republican, so it didn't matter. And that's something I've often said. It doesn't matter about what party anyone is when you show that what you're doing works. They really pay attention to what's the return on investment, how many people are getting served, what are their outcomes. If you can focus on that, you're going to be really successful.
Are you surprised that the outcome is enough? I mean, I think especially in this realm you work in, I think Democrats think, oh, this is our area. This is the thing we really care about. Do you find that is the case, that you have more convincing to do with Republicans?
I really don't. I have found that down to the person, and I approach everyone as a person. I try to approach them with first asking what matters most to you. Our department does so many different things. What matters most to you about what we're doing? We send out a letter, thanks to my incredible director of legislation, Kristen Beloff, each year for the new members as they come in, that outlines what our department does, explains things, and says if you want to talk to us and we can give you more information, we will do so. But I really have found when you start with what are you interested in related to mental health and substance use, what are your questions? What are the things you think are working? What do you think's not working? There's always common ground around that.
Well, we need to take one last break, and when we return, more with Commissioner Marie Williams, who leads Tennessee's Department of Mental Health and Substance Abuse Services. We'll talk about how she brings faith to the job. Stay with us. This is Nashville.
Funding for This is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Blake Farmer, and this is Nashville. Our guest this hour is Marie Williams, Commissioner of the Tennessee Department of Mental Health and Substance Abuse Services. She's been a key leader in partnering with churches, including certification of 1,000 faith-based recovery organizations with a goal to certify many more. She is also quick to bring up her personal faith at times, which goes back to her Baptist upbringing, I'm sure, in West Tennessee. Commissioner Williams, I read that you were a big fan of a book that I did not know about called The Cross and the Switchblade. It's this biography of a street preacher named David Wilkerson, who was working in New York City. And in prepping, I actually read across there. You know, there's a movie version of this.
Oh, yeah.
Starring Pat Boone.
Yeah.
Have you seen it?
I have.
Well, I may work in a clip right here.
I'm just a country preacher, 300 miles from home. But I've got a message for you.
Hey, I got a message for you.
How did it speak to teenage Marie?
So again, you've got my history, my mom, and I'm reading this book, and I'm like, oh my gosh, like what he's doing is combining both spiritual faith walk with outcomes helping those that are down and out, you know, that are on the margins of society. And I don't know, it just really spoke to me so much so because my dad could tell I was really being really touched by that book and what was going on and those services, that he actually took the book from me because he was afraid I was going to get on a bus and go to New York.
So was it a matter of kind of, I don't know what sort of church you grew up in, but was it sort of a saving souls mentality, or was it, I think this is the real work we're called to do?
It was a combination of, number one, this is the work we're called to do. You know, we're asked to love our neighbor as ourselves. And as I read what he was doing, absolutely, he was saving souls, but what he was really doing was starting with what those people needed. He didn't start with, I want to, introduce you to Jesus. He really started with, you need help. What do you think? Do you think you need help? And then connected those individuals with help. And then as I read more, then those individuals realized that his help was coming through Jesus. And he wanted to introduce them to Christianity. So I would say it was a combination of both.
Have you ever felt at times that working in the role that you do at the state level has made you kind of have to check, your faith at the door and not, say all you want to say?
Good. That's a good question. There have clearly been times in my history, all of our history, where certain things are said, don't do this, don't say this, all of that. What I've tried to do is just stick with the primary message, which is love your neighbor as yourself. It's hard to argue with that. So what are the things that we're doing that show that we're loving our neighbors, doing to others as you'd have them do unto you? It's really hard to argue with that. So I do my best to live it out so I don't have to say a lot. But yeah, I really have not seen that to be a problem that I felt thwarted by.
Yeah.
So I hope that answers your question.
It does. When Governor Bill Lee came into office, I mean, he was a little more forward about faith. I mean, he started I believe it was him who started the faith-based initiative thing, working with churches.
He came in and started the the first governor's faith-based initiative. Yes.
So a little more forward about that. And I wonder if you all have felt from any corners of the space you work in mental health and substance abuse, like, hey, you're the church stuff, you're pushing it too hard. Have you had to address questions like that?
I've not had anyone push back on me about what we're doing. Dr. Monty Burks was our first faith-based director in the department. We now have another incredible director, Jamie, who's wonderful. And again, I think it's because we focus on the living out versus, we're not proselytizing. We're not telling people you have to be this or that.
And I think that's probably the fear, if there is some. I don't mean to manufacture fear that does not exist, but I know people have commented, obviously it's more overt faith, and people sort of read faith. Oh, we're talking about Christian, not something else.
And we're talking about all faith. I mean, that's one thing that we have been open with is what faith group wants to be actually certified or community wants to be certified. We don't tell them to be certified, So again, it's really focused on the fact that in our state, if you looked at years ago where there were gaps, look at the churches, look at the places where people are worshiping, because there was so much stigma against someone that was dealing with addiction or mental illness. Monty would tell the story of, if someone has a baby in your congregation, you're getting the casseroles out and, those people can't eat enough of what you're bringing. But when somebody comes home from being in a 30-day treatment for addiction or being in a psychiatric hospital, it used to be really hush-hush. And so
you don't even tell everyone.
You don't. Yeah. So we're really doing this to educate and to transform faith communities so that when people are struggling and they come home, they are as embraced as the mother who went to have the baby. And I just can't say enough about our team and the great work they're doing with that.
If you're just tuning in, I'm Blake Farmer. This is Nashville. We're wrapping up with Commissioner Marie Williams, the head of the state's mental health department. I wonder if you have seen, what is it that churches can do, religious institutions of any kind, that maybe a state agency or even a nonprofit that's not faith-based may have a harder time doing?
Well, number one, faith is pretty central to individuals that go to church or go to a faith community. Yeah. So the first thing is to drop the stigma. Drop the stigma. Tell your congregants, because everybody in the state has either known somebody struggling or they are struggling. So the more that ministers can say, you're welcome here. Not only are you welcome, we want you to talk to us about what's going on so we can connect you, so that embracing of individuals who are in that journey, and then also understanding what the different opportunities are for treatment and intervention to connect those individuals with that. Absolutely, our nonprofits do that, but the faith community is unique in that they are coming there for spiritual help and hope. And so we're now giving a different tool of actual recovery around addiction and mental illness. So that's how they can help. That's different.
Yeah, well, it strikes me that, especially when you're talking about AA, good grief. I know they meet not in churches, but I would say the majority end up meeting there. What would you point to as a way you'd say this is how churches have changed over the years as we've done this certification process. Are they changing that stigma that you kind of warn about?
Oh, yeah, absolutely. When I've had the privilege and opportunity to go to a church, a faith community, and see how our workers, our Lifeliners, Tennessee Recovery Navigators, and our faith-based coordinators, we've got all three working with the communities across the state. And I see that the pastor is like, we've actually started our own 12-step group. We actually are doing recovery groups. We are having all these people show up, and they would have never thought about doing that because of predispositions about, it being a moral issue, right? We're changing people's hearts and minds about what addiction really is. It's a disease, like any other disease, heart disease, diabetes. It's a disease. You didn't ask to get it, you got it. And then there's ways in which you can have an intervention that can help you lead a really helpful, hopeful life of recovery.
I wonder how your own religious views have changed after working so many years with people just in the throes of addiction or otherwise in kind of some of their darkest hours.
I would say that it's not changed, but a deepening in the belief of the healing power of God, that there is healing there, but just a deepening.
When you work with people who have a more difficult time with concepts that they can't see, how do they take that kind of higher power message?
Yes, I love that. I got a really great lesson in Memphis from a woman who led Grace House. She's no longer with us. Her name's Sharon Trammell. And I was sitting in a group learning how to run groups. She's working with women in addiction and recovery. And there was this one woman sitting there, and I was probably 23, 24. This woman said, "I don't believe in a higher power." And I was just like sitting there like, okay, how's she going to handle that? She looked at her and she said, "Okay, all right, I can hear that." She said, "Well, let me ask you that. Do you see that tree out this window right here?" "Yeah." And she goes, "Well, do you believe in that tree?" And she looked at Sharon like, "Well, yeah, it's sitting." She said, "When we talk about higher power, you just say the tree. I believe in this tree. Can you believe in that?" And that was an incredible lesson of not forcing something on someone, starting where they're at, which is one of the things social workers do, and letting her be. And maybe 6 months later she said, "I think I can start believing in something other than that tree." Yeah. So that's sort of what I would say to that. People are on a journey, and as much as we can to be supportive, to offer hope, help, and healing, that's really what I hope that we continue to be in the business of doing.
Well, we'll close with this. I don't know if this is the biggest compliment a Tennessean could possibly get, but someone wrote about you that if it were biologically possible that you might be the offspring of Pat Summitt, legendary basketball coach at the University of Tennessee, and Her Excellence Dolly Parton. Have you received that compliment before?
Yes. And I'll tell you what, that is the highest compliment. I love Pat Summitt.
Well,
I love Dolly Parton. I mean, dang.
Well, as a public speaker, you give off strong coaching vibes. Where does that come from?
Playing basketball from second grade through college.
Really?
I went to
You've
college
heard enough speeches in halftime.
And also went to one of Pat Summitt's basketball camps, read everything she ever wrote. She is a hero of mine.
Wow. Well, Marie Williams, who leads the State Department of Mental Health and Substance Abuse, she's not done yet, folks. Thank you so much for joining us.
Thank you.
Well, thank you for tuning in this hour. This is Nashville is a production of Nashville Public Radio. We air these profile interviews most Mondays. If you're looking for another, I'll recommend a recent episode with record executive and Music Row philanthropist Mike Kerb. who left us with some wisdom about turning negatives into positives and social responsibility. Listen wherever you get podcasts. And if you think others should know about the show, the best thing you can do for us is leave a 5-star review, if you believe in it, and leave a comment about what you like. It goes a long way with those algorithms. Today's episode was directed by Mary Mancini. The masterminds behind our theme music are LaRange and Namir Blade. The conversation does not have to end here. You can comment and tell us what you want to hear on the show by leaving us a message at 615-751-2500. I promise you will listen. You can also find us on Blue Sky and Instagram and X at This Is Nashville. This is Nashville. I'm Blake Farmer. Go in peace.